My name is Tricia. I'm an honors in advanced human development and family sciences major with a certificate in public health, and I'm a senior and I'm on the Ozarks route, and this is why I ride for Texas 4000. So there are 3 family members specifically who I ride for. It's my Aunt Beth, my grandpa, and my grandma on my dad's side. And so my Aunt Beth was diagnosed with stage 4 breast cancer when I was 7 years old. And at the time, I didn't really know what a cancer diagnosis meant. I knew that she was really sick. I knew that she wasn't as lively as she used to be. And I just was really young and didn't really know exactly how to comprehend that information. And when she passed, it was really hard to both watch her family go through it and watching my mom and all of her siblings go through it. I, being 7 years old and not really knowing how to deal with loss and having that be the first loss I'd ever experienced was really challenging. And I think trying to comfort everyone who was really hurting at that time, I also didn't know how to do that when I was so young. And so just seeing the impact that cancer can have that kind of spreads throughout big families is a huge reason that I ride. And then more recently, my grandma Christine on my dad's side was diagnosed with cancer, and she's actually gone through cancer 2 times in her life. She had breast cancer when she was 30, way before I knew her, and she beat that, but then she was diagnosed again in her 80s, and she was really frail at the time and wasn't able to go through chemotherapy at that time because chemotherapy just takes a huge toll on your body. So she ended up, we decided not to do treatment just as a family, and that was kind of hard to watch my family go through that and go through giving her palliative care and trying to make the last years of her life the best years. So just riding for her and everything she had to go through and her not knowing exactly what a cancer diagnosis even meant. And then my grandpa, around the same time that my grandma was diagnosed with cancer, he was also diagnosed and is still going through treatment. He's kind of on and off done chemo, but chemo's taken a toll on his body such that now he's going through dialysis. And so watching his health decline and watching my dad and watching all of his siblings having to go through these things with both of their parents being diagnosed has been really, really difficult, and trying to figure out how to comfort everyone through that while living our lives on the side. Cancer really just brings such a shadow on families, and again, how it kind of has this widespread effect on families is a huge reason why I ride. Definitely a dark time for my family. And one of the really big reasons that I ride, I have the privilege of being a medical scribe for an oncologist. His name is Dr. Chada, and him and his team at Texas Oncology are incredible. I've had the privilege of working as a medical scribe, which is where you take notes for physicians. I've been working for him for a year now, and it's been very difficult to see that has been the closest I've actually ever been to seeing what cancer diagnoses look like. I've watched many patients get diagnosed with cancer for the first time. I've watched so many families having to actually physically take the diagnosis and wanting to be there on the side, comforting them and helping them through it. It's a hard job, and what I'm supposed to be doing is just being the support really for my physician, and I cannot speak highly enough of him and his team, the things that they go through, the sacrifices that they make to make the lives of cancer patients and their families better. Cancer support systems are incredible, and I think that what we're doing here at Texas 4000, giving money to these people who are helping cancer patients and who are making so many sacrifices in their lives to make sure that cancer patients have get the best treatment, that they get the best palliative care if it's that time in their lives. I feel so strongly about writing for cancer support systems and for cancer physicians cancer nurses and cancer MAs out there everywhere. So I feel just so blessed to be part of a team that gives back in such a way, and also just has the strength to do some physical feat that I honestly thought I would never be able to accomplish. I actually just got back from a ride today, and my teammates were encouraging me the entire way through. I also had an experience on Texas 4000 where I broke my toe and had 3 weeks off the bike, and it was definitely a struggle getting back on, but I mean, my teammates could not have made it easier. I'm just blown away by the strength and the perseverance and the dedication that I've seen on this team, and I just feel like such a small part of it. So I'm just so excited to be part of an organization that has such a great community of UT students who are so motivated and so compassionate that they're willing to sacrifice a huge part of their lives to do something so big, to make an impact on cancer. And I just really hope that we're all riding for a cure. I hope that one day I will be sitting here in this same spot, and we will be talking about riding for something completely different, because I see a cancer cure in the future, and I've seen the research going on behind the scenes. I've seen the research that the research trials that my physician is getting patients into, and I've seen patients who before, years ago, their diagnosis would have probably meant that they would have had months to live, living years and decades after their diagnosis. So I just feel really, really hopeful, and I just am so excited to be a part of this organization and make this huge impact that we have the privilege to make. And that's why I ride for Texas 4000.